5 o'clock, a Portland police officer is home recovering after getting shot in the hip this morning. It happened in North Portland in the Kenton neighborhood, while officers were called to help assist federal agents serving a warrant.
And as Devin Haskins reports, Portland police say they were unaware that the feds were serving the warrant this morning.
Well, it's normal for law enforcement officers to assist other agencies. With the federal warrant being served within the city of Portland, Portland Police Chief Chuck Lavelle says his department wasn't part of this plan. Friday morning, federal agents with the DEA were serving a warrant on a man living in an apartment complex on North Willis. The details of that warrant are unknown. Federal agents called Portland police for help when the suspect threatened to shoot them. A tactical team of Portland police officers and a crisis negotiation team were called in to help. As officers began to evacuate residents and set up a perimeter, police say the suspect fired his gun first, shooting through a wall, hitting a Portland police officer in the hip.
This is a call you never want to get as a police chief, to hear that one of your officers has been shot in the line of duty. I'm extremely grateful and thankful that officer is okay.
That officer, a 14-year veteran from the North Precinct, is at home recovering. After he was hit, 2 other officers with the CERT team fired back. Police say the male suspect died. This all happened as residents staying in adjacent apartments were sleeping.
What woke us up was them yelling out his name, and it started off pretty subtle, and then it just gradually escalated. And then we just heard a couple gunshots, and then one turned into a couple, and then now just full-blown chaos everywhere.
Portland police says this is the 3rd fatal shooting by an officer this year, but haven't clearly said if the officer was responsible for the man's death.
It will be a while before we can determine if, what the manner of death was.
The planning behind the federal warrant being served did not involve Portland police. Portland Police Chief Chuck Lavelle says they usually have a good relationship with the feds.
Would you have liked to have been given a heads up?
Yeah, as a police chief, you never want to be surprised by these sort of things.
Part of the investigation going forward into this shooting will involve discussions between both the federal agents and Portland police about steps that were missed so things go better in the future. In North Portland, I'm Devin Haskins, KGW News.
In the pandemic, we're seeing more COVID cases right now among young children. During the week of August 15th, 499 kids 5 years old and younger tested positive in Oregon. For comparison, there were just 46 cases during the week of July 4th. Part of the reason is that more kids are back in daycare and childcare. It's concerning because of the infections, but also because kids in that age group have increased potential to spread the virus to others.
One of the things that you can think about is likely going to happen with kids 0 to 5 is that an adult caregiver is much more likely to be in close proximity to that child, holding them, just in your activities of daily living, changing diapers and bathing and that sort of stuff.
The good news is very few kids who get COVID end up in the hospital. Most have cold-like symptoms. Parents who are worried their kids might have COVID should call their doctor first before rushing to the ER or doctor's office.
Oregon's new outdoor mask mandate is now in effect. Governor Kate Brown says it applies statewide. Masks are mandatory at all large outdoor gatherings where people can't stay socially distant. Now, that doesn't mean that you have to wear a mask when you're walking down the street or if you're out for a hike. That being said, the State Parks Department is asking visitors to wear a mask at crowded viewpoints, trailheads, and other areas where it's difficult to space out. This applies to everyone 5 years and older, regardless of vaccination status.
A number of major events are happening in Oregon this weekend despite the virus surge, and that includes the Oregon State Fair and the Hood to Coast Relay. For the relay, masks are required at the start and finish lines and at the exchange points. Masks are also required at the fair. Also, both events are offering free COVID shots.
We're taking your questions to experts to get the answers you need during this pandemic. Tonight's topic surrounds vaccine booster shots. Here's Kristen Severance.
We've gotten a lot of questions about booster shots, especially with the recent announcement by the White House that they are planning to recommend a booster shot for everyone pending FDA approval. So first off, what is a booster shot? Well, a booster shot is an extra administration of a vaccine after an earlier dose. It's meant to boost immunity. The COVID booster shots would be taken either 6 or 8 months after your second shot. We're still waiting on the final time frame. Now, this could happen, though, starting in the middle of September. Again, again, pending FDA approval. We talked to several experts about boosters for this story. Dr. Marcel Kurlan with OHSU, Dr. Gaurav Sahay at OSU, and KGW's medical expert, Dr. Payal Kohli. Dr. Kohli weighs in first.
So I think we're definitely headed towards boosters as a population. Personally, I wish that we had our Delta specific booster this time around, which I know the companies are working on making right now, especially Pfizer announced that yesterday. But even with the original booster, I think it really is going to help us in our fight against Delta.
It's important to point out that a booster shot is different than a third shot recommended for immunocompromised people. The CDC recommends that people with moderate to severe compromised immune systems receive an additional dose of the Pfizer or Moderna vaccine at least 28 days after a second dose. It's because those people have a weakened response to the initial dose of the vaccine. All right, let's answer some viewer questions now, like this one from Suzanne. So she emailed us saying, once the boosters are available, will that lessen the likelihood of vaccinated people spreading COVID as much, or will it just help the person that's vaccinated? Thank you so much, Suzanne, for that question. Our experts said you are less likely to catch COVID if you are vaccinated.
If you and I get one, we're going to have a less likelihood of getting infected, less likelihood of hospitalization, and also be less likely to transmit to the people around us.
And so therefore, yes, you are going to be less likely to spread it to others just because you're less likely to catch it yourself. So you're benefiting yourself, but you're also benefiting all those other people around you.
Now for our second question. So this person asked, with the booster shot coming soon, is it the same as the first two shots that we got, or is it different? If it's the same, then why can't we get them now? And thank you to Vincent for that question. So the booster shot is the same as the first two shots, but doctors say you should not run out and get another shot, get that booster shot right now, because the FDA has not approved it just yet.
Once they give emergency use authorization to the boosters, I'm going to be one of the first people to put my own arm out to get it. But right now, I got fully vaccinated in January, and it's been much longer than 6 months. I'm just about due, but I am waiting for that regulatory advice before I proceed.
Then we have this question from Jimmy, and we've actually gotten this a lot. Will there be a booster for the J&J vaccine? According to our experts and other health officials, there will probably be a booster for the J&J vaccine at some point. The company is doing research and submitted some data to the FDA this week, but it hasn't been approved yet. And then our last point, one of our experts, Dr. Sahay at OSU, said while there is a lot of talk, a lot of questions about boosters, he said there is still a large percentage of people who need to get their first shot.
Maybe around 90 million people are unvaccinated right now, and they are the major caseload. And so I don't want, people to confuse that the vaccines have stopped working. They're still safe and efficacious. We are just trying to maintain that level, and we are staying ahead of the curve. But the major issue is the unvaccinated population, and these are safe, effective vaccines, and those guys, if they are vaccinated, will be out of this pandemic, much more quickly.
Definitely an important point to keep in mind. Do you have a question about the vaccine, about booster shots, about anything COVID related? Just let us know. All you have to do is email the KGW vaccine team at kgw.com.
Hospitals around Central Oregon are hoping to expand a new COVID treatment following promising results helping COVID-positive patients. It's called monoclonal antibody therapy. In Central Oregon, it's only available at St. Charles in Bend and Redmond. It was introduced there last month. The goal is to expand to other facilities.
It's actually really fascinating. So monoclonal antibodies, they are not human derived. This is made in a laboratory, and it blocks the uptake of the virus into the host cell.
Not everyone qualifies for the treatment. It's only for those who are considered high risk, such as people older than 65 or those with underlying health conditions. Also, you can't self-refer. It has to be recommended by a physician. You can visit Oregon.gov for more information about the treatment and where it's available in the state. Also worth noting, health officials say this treatment does not replace the vaccine because it only treats current COVID infections and won't fight off future ones.
Today, a jury found a Clark County man guilty of murdering a transgender teen. 27-year-old David Bogdanov met Nikki Kuhnhausen on a dating app. The two were having sexual contact in the back seat of Bogdanov's car when he found out she was transgender. Bogdanov testified that he pushed Kuhnhausen away and that she reached for his gun near the driver's seat. He argued that he strangled Kuhnhausen with a cell phone charger in self-defense. Bogdanov later dumped Kuhnhausen's body on Larch Mountain.
The jury did find that she was killed. She was killed intentionally, and she was killed because she was trans. So hopefully that brings some measure of peace to the community, although it doesn't heal the wound and it doesn't bring her back.
The jury found Bogdanov guilty of second-degree murder and malicious harassment, which is a hate crime in Washington. Sentencing is set for September 9th.
In Afghanistan, American forces are racing to finish evacuations at the Kabul airport amid the threat of another attack. A terrorist attack yesterday killed 13 American service members and at least 169 Afghans. The White House and Pentagon warn there could be more violence ahead of next Tuesday's deadline. That's when the U.S. plans to end the airlifts and withdraw American forces. Northwest-based Alaska Airlines is offering to help the U.S. military with the evacuations in Afghanistan. The airline said it would transport evacuees within the U.S. The Pentagon activated a rarely used program earlier this week, calling on commercial airlines to help with evacuation efforts. The military is using its planes to get people out of Kabul.